Hello everyone. Today we are going to discuss about measles. I'm Mrs. Jansi, clinical instructor working at M College of Nursing. So today's objectives are to define measles, explain the epidemiological determinants, describe the pathophysiology, list the stages of measles, and explain the management in detail, enumerate preventive interventions. So introduction, infection caused by measles virus, which is a member of viral family Paramyxoviridae, enveloped positive sense single-stranded RNA virus, that is Mobile virus. So it is a highly contagious virus. 90% of the individuals who are exposed will become infected. Characteristic prodromal symptoms with subsequent exanthem. WHO estimates that approximately 140,000 people died of measles in 2018. Definition: an extremely contagious disease, leading cause of death among children and areas with low vaccination. It is clinically characterized by fever and catarrhal symptoms of the upper respiratory tract, that is cough and coryza, followed by a typical rash. Measles occur only in humans and there is no animal reservoir. The family Paramyxoviridae, genus Morbillivirus, and species it is measles virus. Agent, the causative organism is RNA paramyxovirus. The virus cannot survive outside the human body for any length of time. So the infective material is the secretions of the nose, throat, and the respiratory tract of a case of measles during prodromal period at the end of the early stages of the rash. What is the pathogenesis? Through the respiratory transmission of the virus, through the inhalation, it replicates into the nasopharynx and in the regional lymph nodes and causes primary viremia within 2 to 3 days after exposure. Then it leads to secondary viremia within 5 to 7 days after exposure, whereas it spreads to the tissues. What are the risk factors? Vitamin A deficiency, malnutrition, immunocompromised state, pregnant mothers, and very young or very old people are at risk for measles. Transmission, human to human via droplets. It is an airborne infection. Infectious period is 5 days before the rash to 4 days after the rash. What are the stages of infection? Stage 1, stage 2, stage 3. So stage 1 is prodromal phase, that is incubation period 6 to 21 days, and it is asymptomatic. Stage 2, that is eruptive stage, occurs within 2 to 4 days of exposure up to 8 days. Fever, malaise, and anorexia will be there. 3 C's, that is conjunctivitis, coryza, and cough will be there in the eruptive state. So another typical sign of measles is Koplik's spot. As you see here, this is nothing but grains of salt type appearance. Okay, so this is white, gray, blue spots on erythematous base over the tongue. So occurs within 48 hours prior to exanthem and lasts up to 72 hours. The maculopapular rash occurs 2 to 4 days after fever. Other findings include lymphadenopathy, pharyngitis, splenomegaly, diarrhea. Prodromal symptoms continues, rash darkens to brown in color at 3 to 4 days. Rash fades from head to toe, then it desquamates. Stage 4 is the recovery. Here, improvement in symptoms within 48 hours of rash occurring and may have post-infectious symptoms. And there is also a modified measles. Here, attenuated measles infection in someone who has partial immunity, that is previously infected or vaccinated. Longer incubation period is almost 17 to 21 days. Same symptoms, but less contagious it is. What are the complications of measles? The complications can be mild or very severe in 1/3 of the cases. Measles infection can be fatal. Inner ear infections, that is otitis media. Common bacteria are mainly Streptococcus pneumoniae, Haemophilus influenza, Moraxella catarrhalis. So measles induced immune suppression, that is encephalitis. Acute disseminated encephalomyelitis, that is ADEM. Subacute sclerosing panencephalitis, that is SSPE, also known as Dawson's disease. Giant cell pneumonia, blindness during pregnancy, prematurity, IUD, spontaneous abortion, and low birth weight. So these are the complications of measles. Moving on to the diagnosis, clinical diagnosis, serology, and RT-PCR for viral genetics can be done to rule out measles. Treatment, if infected, supportive therapy can be given with vitamin A supplements 2 days, that is 50,000 international unit for less than 6 months of age group, and 1 lakh international units for 6 to 12 months of age, and 2 lakh international units for more than 12 months of age. Vitamin A supplements to be enhanced. Ribavirin can be given and respiratory isolation should be followed. If exposed, less than 72 hours of exposure, vaccine can be given. Less than 6 days, then IgG can be given. How could you prevent? Again, it is MMR vaccine, that is measles, mumps, and rubella vaccine. It is a live attenuated vaccine. It's a live attenuated vaccine. According to WHO, 73% of the reduction in cases of measles worldwide between the year 2000 to 2018. So to conclude, measles infection can harm the respiratory system, eyes and ears, nose. So the need for the proper adherence to immunization and early diagnosis with prompt intervention can go a long way to reduce the symptoms and thereby preventing measles. So these are some of the references. Thank you.